welcome, my dear friends, on behalf of Rotary India website and app. You are most welcome to the weekly masterclass, which we started about 3 months back, every Wednesday from 4:30. Every Wednesday, we come up with some relevant issues, maybe some Rotary topic, maybe on some service projects, or some administrative issues and benefits. Today is a very, very special day for all of us who are involved in Rotary India. Today, we are having both the sitting RI directors from India, RI Director Raju Subramanian and RI Director Anirudh Roychowdhury, and the icing on the cake is the past RI Director and current trustee of the Rotary Foundation, Dr. Bharat Pandya, is also with us. And amongst us, many of you are aware that in India, in 4 zones, we have 4 senior past district governors as the zonal coordinators of the Rotary India. They are also here. And by this time, more than 150 have already joined. And I'm sure that by the passage of time, there will be many more who will be joining today. Today is a special session. This session is on PPH, Project Positive Health. I still remember when Dr. Bharat Pandya was the director, and we just started the Rotary India website. We had a series of meetings with Dr. Pandya, where it was his brainchild to start this project Positive Health throughout India. And he requested us to create a separate section in Rotary India website on this project Positive Health, where even during the health checkup camps, sitting there in the health checkup camp through a laptop, the sponsoring clubs, they could upload the entire data of the beneficiaries with all their health parameters. With lot of efforts and inputs from Dr. Pandya, and with all our efforts, we have successfully created that module. And till today, we are keeping that module. And every year, some of the clubs in some of the districts, they themselves on their own, they are continuing with these PPH camps, and those data they are uploading, and we are getting a comprehensive data, what has been done state-wise, district-wise, club-wise, and pan-India. And I'm very, very happy that this year, the Rotary top leadership, they have again come up with this PPH camp in a bold manner. And I'm sure that Rotary India backups and what we have created, the separate module, will be of great help to every Rotary club, every Rotarian, and every Rotary district to have that comprehensive data, like the data we copulate and we conceive and we distribute about the service projects that has been done by Rotary Club. And this will be a separate module as well. So welcome once again, my dear friend. And without much ado, I would first request our Rotary International Director, Raju Subramanian, my very dear friend, Raju, to please open the discussion and share your thoughts and views. If by that time RI Director Anirudh joins, after you, I would request Anirudh to share his views. We have one video and one presentation also. In between, if we get time, we will present that. I will request Naren to do that. And afterwards, the man behind the entire thought process, Dr. Bharat Pandya, we will request Dr. Bharat Pandya to elaborate more and to guide us, to apprise us, every club and district to do. So over to RI Director Raju Subramanian.
Thank you. Thank you, Dada.
Thank you so.
There was a hiatus of 2 years when this absolutely outstanding project, which is the need of the hour, of stopping non-communicable diseases called Project Positive Health, started with a positive note when both Kamal and Bharat initiated it, went on well for 2 years. And I think both Anirudh and I felt the need to revive this, because I believe and Anirudh equally shares this thought with me, that continuity is the answer of the day. Who starts a project, who does not start a project is irrelevant as long as the project is good and is essential for the purpose of meeting the needs of the community. And I think there is nothing more than this NCD project that we need to do with Project Positive Health for our community. We are the diabetic, we are emerging as the diabetic capital of the world. Blood pressure is going up, kidney disease is increasing, and each of these diseases are really on account of lifestyle and the fact that we are not controlling what we should and not doing what we should. That is char kadam aage, ek chamach kam, salt, sugar and oil, and 4 kadam aage is at least half an hour walk. I think it is essential for us to realize that in areas which are not urban, people do not even know whether they are suffering from this disease or not, or whether they have sugar or not. And by the time they realize it, it is too late in the day. They already have an organ failure. And I think it becomes a responsibility of us as Rotarians to continue a good project, continue a project which is impactful, continue a project that will save lives in time. And I think it is therefore keeping that in mind, both Aniruddha and me, in consultation with Dr. Bharat, decided that we must go full length into this and ensure that this becomes a project that will always be a project for all times to come, from all districts, and to be endorsed by all the governors, governor-elects, and governor nominees. Friends, what is the need of the hour is essential for us to identify. And I think all of us will agree with this view that the need of the hour is Project Positive Health, because I think the NCDs are taking a big toll on the lives of many, both in urban as well as in rural areas. And I think as we grow with the manner in which we are growing economically, I think the need for this project to be implemented in a larger scale becomes absolutely essential and compulsive on our part as Rotarians who are here to create hope in the world. If we have to create hope in the world, we need to ensure that we give them life, we give them a hope for a better life without disease and without illness. I think, my friends, with these few words, I would encourage each one of you to go back to your districts and formulate a program by which will also be supported with Bharat will come back and tell you at the right time, which will also be supported by the National Committee, which will help you to ensure that you take this forward. It's a simple process. It's not an expensive process. It's a small process which can be done at every camp and can be done in various schools, colleges also, as we are also seeing a lot of diabetes and other issues with the children after the pandemic. There are much more issues that are happening through depression and other things. So I think, my friends, I am urging you, as not as a director, but as a person concerned with the welfare of our communities whom we serve, that we take this project forward in a very, very smooth fashion and support this project at all ends to ensure that we give a safe life to our brothers, sisters, and our children all over the community, whether at the urban or in the rural areas. And I think, my friends, let's start with home. I don't think it is necessary for me to look beyond our own Rotarians to start with, to check out where we stand in terms of these non-communicable diseases. And I think let's start with home and then move outwards and spread the message, inform the people concerned, talk to the community, explain to them the need for the test, and then ensure that we give them that test and the result so that there can be treatment for a longer life, a healthier life for all of them. I thank you all so much, my friends, for joining in today at a very much of a shorter notice. Now, there is somebody who has said, please include cancer and non-alcoholism. Friends, it's difficult really to get into everything at the same time. You are right, but we need to take care of that. But that again is a detective process, which is also an expensive process. So we'll have to deal with that separately. But I'll keep this in mind, discuss it with Anirudh and see how we can take that also forward. But at the moment, let us deal with this NCD alone. and let's see how we can take this forward. Be sure that if there is a good communication coming from you, if there is a good thought coming from you, none of us, neither Anirudh, nor me, nor Bharat, will flinch even for a minute to taking it forward if it is going to save lives and help our communities to lead a healthier and a better life. Thank you so much, my friends, for joining in.
Thank you. Thank you. Thank you, RI Director Raju, for your word of encouragement and clearing the project, how one should go about it. From Rotary India side, we can assure that we already have a separate module there as a PPH module, and the clubs who will do the project, they can instantly upload the project, and every 15 days we send a comprehensive report to both the RI directors and the trustees and the zonal coordinators, and even to each and every district governors pan India from our Rotary India system. So every district governor will be able to know how much PPH camp has been done in their district, so they can also promote and propagate in consultation with the top leadership. So I was told that there is a small video clipping done by one of our past governor friends on PPH. Naren, are you ready to show that PPH? Yes, please do.
We Rotarians of our nation take this as an action. It's time to stress on health, to look after it as well. Good health is like a treasure. Enjoy it with pleasure. Thank you, Dr. Bharat Pandya, to give the lovely idea. एक चम्मच कम चार कदम आगे, एक चम्मच कम चार कदम आगे, हेल्थ को रखें हम आगे। चम्मच कम चार कदम आगे, एक चम्मच कम चार कदम आगे। क्यों न ले ये कसम, एक चम्मच चीनी कम, क्यों न ले ये कसम, एक चम्मच चीनी कम। चार कदम आगे, चार कदम आगे, हेल्थ को रखें हम आगे। एक चम्मच कम चार कदम आगे, एक चम्मच कम चार कदम आगे। कसम, एक चम्मच नमक की कम, क्यों न ले ये कसम, एक चम्मच नमक की कम। फिर चार कदम आगे, चार कदम आगे, ताकि यूं ही ना वजन भागे। एक चम्मच कम चार कदम आगे, एक चम्मच कम चार कदम आगे। कसम, एक चम्मच तेल कम, क्यों न ले ये कसम, एक चम्मच तेल कम। चार कदम आगे, चार कदम आगे करके वेट को कम, क्यों न और भी लगे हम प्यारे। एक चम्मच कम चार कदम आगे, एक चम्मच कम चार कदम आगे, हेल्थ को रखें हम आगे। चम्मच कम चार कदम आगे, एक चम्मच कम चार कदम आगे, हेल्थ को रखें हम आगे।
Thank you so much. That was really inspiring. So I think RI Director Anirudh Roychowdhury has still not joined. So may I request then TRF Trustee Dr. Bharat Pandya to start his deliberation?
Thank you. Thank you,
Yes.
Anshuman. And
Welcome, Bharat.
yeah, thank you, Anshuman. Thank you for the kind words. And good evening, everybody. At the outset, let me thank both the RI directors, Raju Subramanian and Anirudh Roychowdhury, for relaunching this program. I think this is the absolute need of the hour for the whole world, but we'll not talk about the world, Raju. We'll talk only about India, because we are not concerned about the world, but our focus is on India, and your focus is on India. So thanks for that. Let me also make one thing clear. This is not my program. This has to be the program of each and every Rotarian. It is not my program. It is not the director's program only. This has to be the program of each and every Rotarian of India. If it becomes the program of each and every Rotarian, then and only then this program will succeed. Let me give you a very, very simple fact. Let me make a statement. Sugar is more dangerous than gunpowder. Can you believe that? Sugar is more dangerous than gunpowder. A person is more likely to die from NCD, and one of the causes of that is sugar, rather than to be blown up by a terrorist attack or be killed by some shooting or something like that. You know, some simple facts. Let me share with you some simple facts. In the last about 50 years, the life expectancy in India has jumped from, which was around 35, 50 years back, it has gone to 70 plus years. Today, non-communicable diseases, and we are talking about the big 5 ones actually: heart disease, stroke, diabetes, kidney failure, and lung diseases. These account for more than 60% of the deaths. Let me share a statistics with you. NCDs are responsible for 5.8 million deaths in India. It translates into the chilling statistics that 1 in 4 Indians is at risk from dying from an NCD before they reach the age of 70 years. And almost all these are preventable because they are linked to poor choices, poor dietary choices, poor choice in use of tobacco, alcohol, and poor lifestyle choices. And therefore, let me reiterate that stopping NCDs is the need of the hour. Somebody made this suggestion, Raju, that add cancer, add alcohol consumption or whatever. And therefore the this program is known as Project Positive Health. We are not stopping anybody from adding anything they want to add, but we want to keep this program as simple as possible so that even non-medicos can understand these programs. Club can implement this program in a very simple manner. I will explain a little later what are the 3 main components of this program, which are very easily implementable by clubs across. There is no club even in the remotest part of rural India which can say that no, we don't understand this program and we cannot do this program. And the aim has to be, Raju and Anirudh, that in these 2 years, this program has to spread to the grassroots levels. If it spreads to the grassroots levels, then this will become a sustainable program, because this program cannot work in 2 years or 3 years or 5 years. This has to be a long-term program, at least 15, 20 years, if not forever, actually, because NCDs are not going to go away just like that. So the 3 main components of the program. The first is this issue is because of the improper lifestyle and bad food. Today, bad food kills more people than anything else in the world, friends. More people die from bad food than from wars, terrorists, accidents, everything put together. Food, you just saw the video, which is rich in salt, oil, and sugar, friends. Improper lifestyle, too much stress, excessive use of tobacco and alcohol, and no physical activities. This results in obesity, hypertension, and diabetes. Director Raju mentioned that India is the diabetic capital of the world. We have the dubious distinction that 1 in every 6 or 7 Indians is a diabetic. So if there are 255 people, there will be at least 45 to 50 people or even more, because Rotarians are probably the prime targets of all these NCDs actually. So I think we need to make those proper choices. So what are the 3 main components of this program? The basic issue is lack of awareness. I don't want to ask this question here, but introspect yourself. When was the last time you got your blood pressure checked? You got your blood sugar checked? You got at least a simple routine body checkup done. I don't remember that when I got it done. Let me be frank and say that. So the problem is lack of awareness in the community. How do we create this awareness? Rotary clubs across the country are known to hold health checkup camps. Many of these are preventive health checkup camps and also offer some treatment. So this, for this PPH, Project Positive Health, Stop NCD project, we call these camps as Know Your Numbers camps. And what are these numbers? Height, weight, blood pressure, and blood sugar. Height and weight, by a simple calculation, weight in kilogram upon height in meter square, gives us BMI, which is body mass index. Up to 25 is normal, 25 to 30 is overweight, above 30 is obese. So that is the first thing. Blood pressure gives indication of hypertension, and blood sugar gives indication of diabetes. So this program is asking Rotarians to just have these 4 parameters, at least, when they do these camps. And we are not looking at camps which touch thousands of people. We are looking at small camps, 3 hours or 4 hours camps, which look at touching 150 to 200 people at the max. So height and weight will give an indication of obesity, blood pressure will give an indication of hypertension, and blood sugar will give an indication of diabetes. And these 3, obesity, hypertension, and diabetes, and a combination of these 3 are responsible for all those big 4 ones. Heart disease, stroke, kidney problems, and of course, diabetic issues. So the basic premise, and Naren is going to explain, that we just don't do this checkup and then forget about it, but we do this checkup and upload the data onto the website. We do this checkup and share that data with the people who come there to get this checkup. And we advise them that it seems that you have an issue, you have a blood pressure issue, you have a sugar issue, please go and consult a physician. Now, I believe that Rotary's role has to be that of a catalyst. We cannot be treating thousands and lakhs of people for their lifestyle diseases, but we can definitely make them aware of their lifestyle diseases. But as an additional thing, what we can do is a follow-up and evaluation, because the website will have their contact numbers, and randomly we can at least pick up few of them and follow up with those people, whether they did something about the issues which we shared with them. So monitoring and evaluation also will be possible because of this website, which the data which is uploaded on the website. So that is the first thing, what we call as know your number scams. The second thing is the beautiful video which you saw just now, made by one of the governors in 2021, Rajan Gandotra from 3250. Excellently made video. And Naren, I saw so many requests of people across. They want this video to be shared. And I'm sure, Rajan, you don't mind sharing this video with everybody because that is what it is for. As I always say, and I'm sure Rajan believes that whatever we share is never a copyright with us. It is there for the use of all the Rotarians. So the second is awareness. Through this campaign, the Ek Chamach Kam, Char Kadam Aage campaign. Ek Chamach Kam of salt, oil and sugar in our daily diet. Char Kadam Aage is exercises, as Raju said, 30 minutes of exercise at least every day. That is the second arm of the campaign. And this awareness campaign has to be done by each and every Rotarian. Let's make it absolutely blast social media with these type of awareness campaigns. And of course, the third one is awareness campaign in the schools, for which we have tied up with an organization which is known as Arogya World, which already has a program for reducing the burden of NCDs, which is aimed at the school children in 7th, 8th and 9th standards. Why schools? Because it is very difficult to change our mindset, friends, adults. It's difficult to change adults' mindset, but it's easier to change the mindset of the children. And if we change the mindset of the children, they will go back and change the mindset of their families, their friends, and those people who live in their houses. So therefore, the school awareness program. The details about the school awareness program will be shared with all of you. Director Raju and Director Anirudh have formed a national committee of zonal coordinators. There are some veterans who are there in this committee. And I just saw Dr. Vijay Kumar is one of the champions of that. I just also saw Dr. Ashok Singh there. Again, another champion. I saw two of the governors, my governors, Sudeep Mukherjee and Rajan Gandotra. Let me tell you, friends, this program was going great guns in 1920. Unfortunately, COVID struck, and then those camps could not be held. But these two people, these two governors, and it's not that others did not do it, but these really went out of their way and saw that camps were not affected. They, with all the COVID precautions, Sudeep and Rajan and their teams, of course, carried out these camps even in 2021. Naren has those statistics. I don't have it immediately, but I think thousands of people were checked and through these Know Your Numbers camps. So these zonal coordinators, national committee members are people who are experts. Most of them are doctors. They are who are experts who will be available to guide the districts and the district teams in how to go about implementing this program. And you know, when we launched that program, we said that let's conduct camps on fixed days. So 4 days, 29th September is World Heart Day. 14th November is World Diabetes Day. 23rd February, you know what 23rd February is Rotary's birthday. And 7th April is World Health Day. So we suggest that you hold at least one camp each on each club holds at least one camp each on these 4 days. But I go along with Director Raju's suggestion. I believe that the first camp that each club has to hold is for their own members. That is most important. First camp has to be for our own members to make them aware of the issues they have so that we can prevent and decrease the burden of NCDs amongst our own members. We had partnerships with few of the organizations, and Dr. Vijay Kumar, I am sure that we can revive this partnership with IMA. We can also revive the partnership with the ThyroCare. And you know, these 4 parameters which we are talking about, height, weight doesn't cost anything, blood pressure doesn't cost anything, blood sugar also hardly costs anything, friends. Each camp will cost you at the most 2,000 to 3,000 rupees. And plus whatever little bit infrastructure cost is there. And the beauty of this program is that what we are recommending, what the directors are recommending is that you do minimum this much. You can add what you want to add. You want to do lipid profile, you can do. You want to do kidney checkup, creatinine, renal profile, you can do that. Add that. There's nothing that stops you from adding whatever you want to do. And of course, we also expect that at these camps, before the camps or after the camps, we can have some street plays or rallies or something like that to create awareness in the community about this program. So that in a nutshell is about the project Positive Health. Stopping NCD is one of the government of India's key initiatives now. In fact, there is a Stop NCD department in the NCD, not Stop NCD, but an NCD department in the government of India. And I think we will explore, Raju, this possibility if we can contact somebody, some secretary in that department and see how we can collaborate with the government also to take this program forward actually.
Bharat, pausing here for a moment, I have already met the Director General of Healthcare in the Ministry of Health last week, and I've had a chat with him on this. He's very enthused with the fact that if Rotary can really collaborate with them, then they will also send out a missive to all their agencies to collaborate with us. And these camps can be held in government hospitals at no cost at all. So
Fantastic.
I'm making a proposal for that purpose. And the second thing which Anirudh and I have, which we want to announce, is that the district that does the maximum reach of this program will be also given a recognition, a special recognition. The top 3 districts in the country will be recognized specially. It's an incentive, because I think incentives do work with Rotarians, Bharat, subject to what you say. This is what my thought is for that purpose. I'm again going back to Delhi next week, and I'll meet the Director General again and see how best to take this forward.
Excellent. This is an excellent initiative, Raju, and that is an excellent thought to recognize the top 3 districts. And that is why what Naren is now going to explain, because that will recognition will come with that hardcore data which is there uploaded on this web, on this app actually. And that is what Naren is going to explain. So friends, in closing, let me share with you again something, you know why we came up with this ek chammach kam char kadam aage, friends. You know, social media requires some catchy slogan. I mean, you just say, okay, stop NCDs. It doesn't enthuse anybody, but you say something like this, you know, what a beautiful video that was here. It really inspired everybody. I'm sure everybody loved seeing that video. So it's something like that. There's something to inspire people, something to catch people's attention and eye. So let me again add with another 4 lines. As one of my friends says, पेट को रखो नरम, पेट को रखो नरम, पैर को रखो गरम, दिमाग को रखो ठंडा, तो बीमारी को दे सकोगे डंडा. पेट को रखो नरम means keep your tummy soft, means control the food. पैर को रखो गरम, keep walking. दिमाग को रखो ठंडा, let stress, तो बीमारी को दे सकोगे डंडा. With that, let me end that. And of course, you know, one of the things that we need to add to this is what the 23-24 President's Initiative, the Mental Health Awareness Campaign. So that is something which is easily, you know, the beauty of this program, Raju, is that whatever you want to add, it is easily addable to everything like that without too much of a cost to whatever is you are doing. And please be assured that there is no cost involved to any club to pay anything to anybody. I think this, whatever data is coming up on the website is available to you without any cost to any club actually.
Bharat, one more thing, just see the message from Arun Bagadia from 3056. He says that I can take support from the Health Secretary Sudhanshu Pant from the Rajasthan batch.
Okay.
So that is so. I think Arunji, we will connect with you and we will also try to take this forward. Bharat.
Sure.
As many hands to help.
So
as we
anybody, whatever some suggestions you have, please, you are free to write to directors, to write to me, to write to Naren Rao, or write to the national committee members who are there and who will be in close contact with your district. The national committee member, the team which is formed by Raju and Anirudh will be shared with all the governors so that all of you will also come to know who are the people. I think one person is in charge of 2 districts, which makes it very easy for that person to work for those 2 districts. So with that, friends, let me end and hope that this program continues for a long, long time to come so that we can really, if we can reduce that burden by even 10 to 15%, that will be something, a great contribution to our nation actually. Thank you very much.
Bharat, Dr. Venkateshwar Malla has got a question.
Sure.
Doc, unmute.
Yes. Yes, sir. Yes, sir. Actually, in the District 3020, we are continuing this program for the last 2-3 years also.
Yes, yes.
Earlier, we have done very good program, massive diabetic screening camp we did now. But till that time, we continued this program every week. We are surprising to note, till now we are doing Know Your Number program from the Rotary Club of Vijayanagaram, my own district, my own club. We are doing on every week. In addition to the routine height, weight, and blood sugar and urine examination, we are doing also ECG also, especially for the high risk patients. Because on the day of program itself, we know some patients are obese, some patients are at high risk because they bring the records of having the I'm already diabetic, I am also diabetic, I am also hypertensive. Like that, every camp now we are getting more number of patients of these things. Second thing is we have tie-up with the University of Health Sciences in our district. The previous governor, the current governor Datsubbarao and previous governor Ramarao and myself, and even including Bhaskaram Gar also, we have MOU with University of Health Sciences at Vijayawada, so that now they will we are providing the equipment, they are providing the manpower, including the doctors also, University of Health Sciences. And this program is continuing in the District 3020 for the last 2 years. During my year also, I am continuing this the same program, so that in the other districts also we can have this NCD project is there in every University of Health Sciences, medical college related universities. This NCD project is there, so that we can have tie-up with NCD projects of respective districts, respective universities, so that they will help you out in organizing this program along with the medical colleges. The second thing is we are talking about the sugar. Limit sugar like this. No, in addition to the sugar, we have to tell one the another word. Highly refined, non-nutritive carbohydrates is also equally contributing for the most of the non-communicable diseases. In addition to the sugar itself. So because people are taking more rice and more refined foods also now. There is also one of the reasons for non-communicable diseases, because not only this program is in urban areas. Now we see a lot of cases. Being I am a pediatrician, I see a lot of cases of obesity in children itself. So we want to do this program for children also. Know your number, so that no, you can detect this program as a school health program. What we are doing now, we are going to schools and we are taking the height, weight, and measuring the BMI. And if any child comes under obesity or overweight, both we take into consideration, and we're prescribing the chart also, nutrition chart, what they are supposed to take, how much exercise they are supposed to do on daily basis. Unless we escalate this project to the school health, especially for children, as you said, no, we cannot change the mindset of the adults. We can change the mindset of the adolescents and children, so that we're involving the more Rotaractors and interactors into this fold, so that we can escalate this project to the massive way.
Doc, please promote
Thank you,
it
sir.
in your
Thanks.
batch. Please
So-
promote this in your batch. I find very few governor-elects come here, though we had invited them. Please promote it in
Yes.
your batch. Please. Thank you.
You know, there are
Sure.
many districts who did a great job, Raju. Mohan Prasad did a great job in 3020 along with his governors and everybody like that. Rangnath Bharat did a great job in 3181. I'm not mentioning everybody because I think the program was going on very well, but then got a little bit of a delay because of the COVID pandemic here. I think there is some question, but I think let's finish this question and then let Naren show how
I
to
think
upload on the
Prashant-
app, and then if there is time, we will take some more questions.
Prashant, kindly be brief in your question, please. Prashant, unmute कीजिए.
Yeah, let me be brief. I think some of them, the parts are covered already. I am from Rajarajeshwari Nagar Centennial, Bangalore, 3191. We have started a program to align with the PHC, Public Health Center, on the diabetes management. Okay. We want to do the diabetes reversal. So it's just not awareness building. We want to take it and bring it to closure for selected underprivileged the citizens. So my question is, can we, as some of you are already talking to secretaries and government authorities, if there's a clear communication that PHCs can and should work with Rotary, or Rotary has a ability to work with PHC to set up this NCD program. So we can do once in a week. It's an automated, auto mode. We can create it, set up the platform and the templates, and that can run on a regular basis.
So I believe, Raju, that the answer to this would be that it has to be with the local state government.
Yeah.
It could probably not be a national directive to all the PSCs to collaborate with.
Not be, but Mahadev Prasad from his district, Bangalore, has just put a message saying that we are collaborating with the government on that score. So wherever there is state collaboration, we can take it forward. And if we can get national collaboration, in fact, Arun Bhai has been very sweet. Arun Bagadia, he's messaged me privately, said, Raju Bhai, we will talk and I'll take it forward with the health secretary. So that's very sweet of him. I'll contact him and take it forward.
So before, Naren, before you go, let me make one thing very clear, friends. As I said, this program, what we are sharing with everybody is something very basic, which is something doable by everybody. You are free to add, as Prashant said, that this Dr. Venkateshwara Rao said that, okay, we'll do this for the school children. Yes, of course, 20% or more obesity, Dr. Venkateshwara Rao, in kids in India. We are actually sitting on a volcano as far as the kids are concerned. These kids, already Indians have these problems at 50, which the world has at 70. All of us know people who have had angioplasties and bypasses or who have passed away because of heart attacks and strokes at the age of 50 or 55, which happens in Western countries at 65 or 70. So I think please understand that the aim of this program is not to force anything on everybody, just give you a basic outline that this is the minimum we expect that you should be doing. And then you can add whatever you want to add, whatever extra you want to add as far as this stopping NCDs is concerned. With that, Raju, over to you and then to Naren for...
Thank you, Bharat Bhai. And I think Anirudh Bhai is stuck somewhere. But friends, let's take this forward with a great deal of seriousness. I think it involves... Anirudh Bhai is here? Anirudh is here?
Yes. Anirudh has joined. So let us on behalf of Rotary India...
let Dada speak, please.
Yeah. So on behalf of everybody, let us welcome RI Director Anirudh Roychowdhury. He was in another meeting. So he completed that meeting and rushed to our meeting. So Anirudh, already RI Director Raju Subramanian has spoken. We have shown a video made by Rajan Gandhatra, and then detailed, elaborated discussion has been made by Dr. Bharat Pandya, and we took up a couple of questions in between also. So now it is your time to speak up your mind, because RI Director Raju was always referring to you and Raju. You talked together, discussed together, decided together, and we have decided to relaunch this program in a big scale. So after you, Naren will show us the nitty-gritty of the Rotary India website, where and how this PPH camps reporting would be done. But before that, it's all yours. Over to RI Director Anirudh Roychowdhury.
Thank you, Anshuman, the chairman of this Rotary India portal, and good evening to all my friends present here. And I must also acknowledge the presence of the architect of this program, Dr. Bharat Pandya. In fact, I can still recall during the time he was serving as a Rotary International Director, he is the one he conceptualized this program, and along with his co-director, Kamal Sangvi, it has been rolled out nationally, and it was doing extremely well. But unfortunately, as you know, that due to COVID and it got stuck. And when you bring this program to a certain, to bring to that momentum, and then there is a certain stoppage, all the activities, naturally, it has come to a stage that we have now just to push it. To my understanding about this program, very simple, as a last statement made by Dr. Bharat is absolutely, it is very candid, and that is the essence of the entire program. Very simple, and it is doable, and it is scalable, and we can backward integration can be done for all others, diseases, backward integration has been done. Just a small example I'll give it. Few weeks back, I was in Coimbatore for one of the district's program. Then, one of the doctor was there. So he was mentioning post, that program. I would like to, talk to you regarding this, menace which is coming in India, or the fatty livers of the students. So I would like to talk to you about this, and if you can take it forward. I said, another program is, our program is there. So he was not aware of this program, Positive Health, initiative. And then I just narrated, and he said, oh, fine, that's good. That is the program we should run. So which gives an, that kind of, that confidence for all the Rotarians here. But we are in the right directions. That is what is Rotarians' job. It is creating awareness. There are many diseases can be, if we can prevent it. That's why there has been a change in the, the concept of Rotary's, that focus area. It is not only the diseases, preventive and curative. Preventive also and curative also. So it is a preventable disease. At the same time, we are aiming at a larger context that we are not only preventing, but also, curing the disease already has set in. That Rotary is always there. This is in fact, it is a ecosystem, full ecosystem, because we are, according to, all this, if you go to the figures in the global grant, even for Rotary India, whatever money we spend every year through the clubs, for various grants or for other resources, we get the fund, more than 55 to 60% spent on healthcare, followed by maybe, water, sanitation, education, all this. But 50%, more than 50% spent on, the healthcare. So that is that this is another area Rotary is knee deep today to ensure good health and the diseases which can be prevented. So this is one, is I can tell you, my friends, all the learned friends are there, I find, all the past governors, and they know that, that how this has to be taken into the ground level, to the level of club level. We know the structure has been there. We are also having the, that structures we can make it more robust. If there has been some, flaws somewhere, that Dr. Bharat, he has been the architect, and during the time he has been, navigating this program very minutely. So he knows where have to be plugged in, any shortfall, any lacuna is there that can be plugged in. That is no problem. But then there's a high time now. Let us roll out this program. And I'm said that Raju and myself, we are committed. We said we had a meeting with Dr. Bharat, and where he said, yes, we'll say, not only support, we will ourselves ensure that the program goes in the right direction, and we are, creating that structure once again, and building on the momentum. It will take time, maybe to set the whole things in right perspective, because it was not there at all. So we have to have a training program, in different level of training programs. So we have to, that all the national committee members already been finalized. I think Naren must have shown that figure, that slide to all that are, viewers today, all listeners, our audience today. So we will be in touch with the governors, maybe from first week of September. We'll be in touch with the governors. We'll try to build up this, that structure once again, and we'll start immediately. Or Dr. Bharat, if he has something in mind, we can discuss. And any specific day he wants to, it is to launch it once again or relaunch it once again. We can also do it nationally. So, but I am not going into technical aspect. A lot of doctors, professionals are there. Bharat himself has spoken about this. We are there. Myself and Raju is there to ensure this program will go to its right spirit and right directions within the framework has already been drawn by the architect of this program. anybody for this matter, a lot of, the physicians, they have, shown interest. I have received, Vijay Kumar has sent a booklet today, Dr. Vijay Kumar. So I haven't seen the Vijay Kumar's booklet, all very comprehensively covered that booklet. And this is, that they are all showing a tremendous amount of enthusiasm and interest to carry forward this program. So I'm not, prolonging my, that's this kind of advisors or anything. It's not advisors. It is just doing this program together, and I'm sure together we can pull up this program during this, this coming years. For this, already we have consumed 2 months. Nevertheless, we'll make it up with we have to put in extra effort to to bring that program to that to a level of that momentum. And by this month, the month of September is very important for us. And let us understand what is his having in mind when we should launch it, or we should start initiating discussion with our governors. So if he can give us some guidance on this, and immediately we will start this program. Thank you once again for giving me this opportunity to to speak my mind and my thoughts in front of you. Thank you.
Thank you, RID Anirudh. Before I hand it over to our Rotary India webmaster, Rotary Anirudh Rao, just I would like to share some of the information. We are very happy that so many past governors and a few current governor, DGE and DGN are here with us. That will help spreading the program very fast. I already had a talk with past Governor Rajan Gandotra from District 3250. The IFRM team has made this beautiful video, and he has agreed to allow us to share this video with everybody. Now, what we normally do, every week after the master class, those who have attended this master class, by the same evening, we sent an email to everybody with a synopsis or a minutes of the discussion that held in that master class, along with the link of these, some of the PowerPoints or the videos or whatever is available with us. So I'm sure Naren will be able to, and his team will be able to send the email by tonight to all the registered delegates today, along with this video. Also, Rotary India is having a separate YouTube channel. Every week, the entire video recording of the master class is immediately uploaded to the Rotary India YouTube channel. And that link is also shared with the email that we send on the same evening to all registered delegates. So I request Naren also to upload this PPT video in our Rotary India website channel separately as well. So anybody wants to even download at a later stage who has not joined today's program, they can also do it. So please do it. And I'm sure everybody will be able to access that video, and that will help in promoting the program in a larger scale. Now over to our webmaster Naren Rao for making a short presentation on how best Rotary India website and app can be used and utilized to upload and update the PPH program and the data. Over to Naren.
Thank you, Anshumanji.
Naren, before you leave, I think Raju needs to go to another meeting. So let me quickly.
I have another Zoom at 5:30, so
Okay.
I'll excuse myself.
Just before you leave, couple of points. I saw in one of the chats that diabetes is mainly an urban problem. I think we need to clear this misconception that all these NCDs are not urban problems. Rural people are as much affected by this as by anybody else.
Absolutely.
Age, caste, creed, economic status, social strata. NCD doesn't choose any of these actually. So that is the first point. Second point, Anirudh talked about launching this. I think we have this World Heart Day coming up on 29th September. So I think that is the perfect time for clubs to launch. We have about a month's time, which is good enough for these know your numbers camps. They are not elaborate big camps. Clubs can easily do that. On 29 September is actually a Friday. So clubs could do it on 29 September, or they could choose to do it on 1st October, which is a Sunday, which becomes easier for the clubs to do. But that is a time for it to launch. And the third point, I think what we will do, Anirudh Raju, that we will probably have a meeting with all the national committee members quickly in the next week, as early as possible. And then they can take this forward to the governors, actually.
Totally.
And the third point is somebody was asking whether there are common flyers and all that. All the committee members had come together and come out with some common flyers and all that a couple of years back. Those designs are already available. You will have all those designs which are available. This needs to be just changed to suit the circumstances and to suit your club requirements, actually. So those designs will be shared with everyone.
But also, maybe it will have to be changed to the language which is necessary for the area that they are going to do it. That's the message I put on the group.
Many of these national committee members did it and changed that to their own Oriya or Kannada, all that. So they are all aware of this here. Many of them are veterans in this program, so they will do this job.
I know. The only two who are not veterans are sitting with each other with you now, Anirudh and me. So
please don't take it in that. Let us go ahead.
Thank you, guys. I need to leave.
But I can just, Raju, during the, that last, when, that this program was launched, and, the Kamal was the director. So Kamal has given me some responsibility to ensure this is, that is run in the 2006 in a right manner. So I was involved in this program in that point of time.
So I'm the only novice.
No.
Bharat, already Ashok has put, Kusum has put that these flyers are available.
Yes, they are available.
The flyers are available, really.
Yes.
So thank you, guys, and thank you so much, Bharat and Anirudh. My apologies. I have another professional Zoom meeting at 5:30, so I will probably have to go for that. Thank you.
No problem.
Thank you.
Naren, go ahead.
Thank you, Raju. I have already shared the flyer received from PDG Rajan Gandhopra in the chat already during his year. So everybody can copy that and make those flyers according to change the logo, and they can do it. As Bharat was saying about the flyer, I have just uploaded it in the chat.
Yeah.
Okay. So over to Naren now.
Yeah, I'll just share the flyer. So this was the design which was done earlier. Of course, you can change the logo and you can change the club name and details down. Yeah. So getting into the actual action. So now how this data will be entered in rotaryindia.org. So as and when a new camp is done, how and what data can be entered. So let's get into the action. So I'm sure all of us know that every club president, secretary are the admins for Rotary India, and they have the rights to get into this and create a camp. So now as an admin, how will this happen? Let's say now I'll just go to one of the clubs. So as an admin, you will get into your club and you'll see this page. And here there's a button called as PPH camp. So when you click on this PPH camp, there's an option for you to add a camp. But before that, you can see a reference chart so that you can actually know the reference chart that you need to actually follow during the camp. This is one. And second, when you click on add a camp, let me show you how simple it is. Let's say now this camp is happening at Thane railway station. Example. Example, this is happening today. In case you want to put a logo to this, you can also do it and save. See, now there are chances you will have more than one doctor simultaneously working with the attendees. Now all the doctors or all the admins can actually go and add the attendees data. So what is the data that we add? So when you click on add an attendee, it will ask for the name of the person whose diagnostic we are doing, and mobile number, sex, address, age, the blood pressure, the both has to be written here, And the blood sugar, in case it is a fasting, then it is FBS or it is RBS, you can write it here. His height in centimeter and weight in kgs, and automatically the BMI will be calculated. And then just select this button, whether diabetes is existing in a particular person, then you can click on it, or if it's a new diabetes detected. Same thing for a pre-existing high blood pressure or a new high blood pressure. If the person is overweight, you can tick mark here, or obese, you can tick mark here. Then a consent is typically, in case we want to communicate to him in the future, we can also take a consent from him that would you like to get health related messages on your mobile from the Rotary Clubs. Plus, in case the doctor, the person who's handling it, wants to write any remarks, can also be added, and click on save. So now this data gets collected in the central database. So end of the year, we'll be able to know the number of people who have been diagnosed. Second, imagine the same person comes again for during the next camp. The system will also track that. It will also track his earlier records. So you will also know the comparison. Imagine he had come last time and his parameters were this, and he's come again. Now his parameters is this. So end of the year, we can also know the same person coming multiple times and his records are tracked there. Plus, this entire data is available for a club to report it to the district, and of course even the district will have automatic reporting of this. So even in the reports, the entire PPH camp that is done and the attendees, you can download it for your records. One. Second, even in the district module, the district governor can actually track how many such camps are happening in the district and the details about the attendees. So same level, the next level to the national admin, that is both the RI directors will get a data of the camps happening in the entire country and these numbers. So then thanks to Trustee Bharatji, so we'll also be enabling this number in the main screen of Rotary India soon. So that means there will be a count of how many camps are done and how many attendees are attended, so that how many numbers are, how many people are checked. Even that number will keep on changing every day, because then as and when the number of camps will happen. So this is what is there in the Rotary India platform. So I'm just repeating it. All you require is get into your dashboard and click on the PPH camp in the e-governance or a reporting module, and then everything is simple. You just have to click on the add camp, create a camp, and once you create a camp, there is an option for you to keep on adding the attendee. And once a camp is completed, you can go and disable this camp. So that you don't need to add in the same camp, you can create another camp. So reason is, in case you want to have the number of how many number of camps that you have done, so it's also possible in the system. So friends, this is what is the tool which is going to help us, and anybody has any questions on this, we can actually take up the question answers towards the technical part. But in case something which is asked to be asked by the directors as well as trustee, you can also ask those questions, and luckily they are here and we can take up the questions. The first
I saw
question.
two people, Dr. Suresh Babu and Joshi. So, Suresh, unmute yourself, please.
Yeah, I just unmuted CS Joshi.
Yeah.
Yeah, good evening, everyone.
Good.
I'm Dr. Suresh Babu, District Governor-elect from RI District 3203 from Tamil Nadu. I am from Ooty, basically. I'm a general surgeon as well as an ophthalmologist. So in our home club, Rotary Club of Uttagaman, we've been conducting eye camps for the past 15 years. As soon as I entered Rotary, I thought this should be a continuous project, and it is a sustainable project also. Even every month we are conducting, even now also. But my only query to our distinguished guests is, how do we follow up these patients, especially for the NCEDs? Know your numbers. Is one camp is not going to be enough. And what are the steps that will be taken by Rotary to follow up these patients? That's my question, sir.
So, Dr. Suresh, it's like this. I said before that Rotary, the role of Rotary has to be that of a majorly of a catalyst here. I understand that ultimately we should be treating, I mean, seeing that they get treated and everything like that. But it is impossible. The basic idea of this is to create a mass awareness about this issue actually. What we can do as an add-on, additional thing, is that we have the numbers of these patients. So somebody from the club, or it could be some secretary or some employee, can bring up these patients and ask them whether they have gone back to their physician, they had this sugar issue, they had this hypertension issue, whether they have gone to their physician. If not, advise them. See, beyond that, it is impossible for Rotary to, we are looking at maybe touching 6 to 10 lakh people across the country every year, at least at the minimum actually. It's impossible for us to handhold all of them and see that they get treated for whatever issues they have or problems they have. But we can do this small follow-up. That is again up to the club to decide whether they want to do that follow-up. It will be very good if they do that follow-up, but that the club can do it at the end of the camp, maybe a week down the camp or 15 days after the camp. We can have a follow-up of the people who attended the camp.
But it will be possible only through at the club level, sir. That's my point.
Yes.
Because at the district level, it may be difficult to coordinate all the clubs. So at the club level, it will be possible to
Yes,
follow.
it is possible only at the club level.
Yes, sir.
Yeah, can I add? Can I add, Bharat?
Yeah.
Yeah. So you know that Dr. Suresh, how are you?
Yes, sir. Fine, sir. Thank you, sir. Thank you.
I was just on that day. We were waiting for to meet you, but you couldn't make it. However,
Yes, sir. I was not able to come, sir.
Yeah, understand. So the thing is, you know, that this particular for this, the way we are now moving, we have to have a collaboration with the governments. Otherwise, we cannot take it to the logical conclusion. Because the government is very keen to get this data. And the data analytics is so simple these days. So what you can do, the data, what you are generating through these camps, so you can give it to the district office. So we can have the district office, then we can, you know, separately we'll work it out that how this data can be given to the right, the kind of a right ministry or the right place, or the, medical colleges and all this, so that they can also take care of those things. So you have to collaborate with the government, that only we can scale up this program in a national level. And it is a good program, and they want that people in the ground to, do this work. So you have to, think on those, that perspective, we have a bigger perspective. You have to see the bigger picture for that. So I think it is doable. We can do that. And today's the data analytics is the name of the game. As we can do it. And we have a people here. So I think we can think on those lines, what you said, and we can scale up. We can do this.
Sure. Joshi. We can hear you.
Hello, can you hear me now?
Yes, yes.
Okay. Good evening, sir. It's a very good initiative by Rotary India. There are some technical things which I thought I'll just share with you and Mr. Rao. See, when we go for such kind of camps, maybe taking laptop or taking computer could be an issue. So can this app, only this particular thing of entering data of this thing can be have app on mobile or something like that, so that it is connect. I mean, anyway, we have got our Rotary India app on our mobile. So maybe some small thing only for data entry purpose, can it be done from the logistic perspective?
So Joshi, actually the issue here is the number of parameters which you are going to enter is more. So the risk is, in case you get a call in between, and then in the app you will have a problem. So my suggestion is a simple laptop or a small iPad or something which can be much easier for you to do it for this day, because it is not one entry. There are at least 10 to 12 entries, and again there is a time lapse. Example, so now the diagnosis is going on, and then they need to get those entry done in a specific time. So my suggestion is mobile might not be an easy thing to do here.
Okay. Okay, got it. Thank you. Thank you very much.
Okay. Ghanshyamji. And Naren, unmute Ghanshyam Das and Dinesh Jain here.
Yeah. Ghanshyamji, unmute yourself.
Good evening. I'm Ghanshyam Das from Rotary Club of Bokaro Street, District 3250. My just question is there any age criteria for the person need to be checked for this PPH?
No age criteria.
No age criteria.
No age criteria.
It should be only adults or can be children also?
Children also.
Children.
Dr. Venkateshwar Rao just mentioned that, and you know, the fact is that 20% of Indian children are obese. So children are required to get all these tests done.
Oh, thank you.
Dinesh.
Good evening, sir. My club holds a blood donation camp every week to support thalassaemic children. So we plan to take up this project in these camps. So Narendra, will you be sharing this video and the pamphlets in the mail that you will be sending post this meeting to the attendees?
Yes, I will be doing that.
Okay, thank you.
Thank you. I think somebody wrote, Lata wrote that presidents are very, but this is not that, it's the president's choice. It need not be a past president who is in charge of the program at the club level. It could be a Rotarian who is in charge of the program at the club level. Anybody can be in charge. It's the president's choice to whom to be in charge at the club level. You're muted, Lata. We can't hear you.
The question was who, not who is appointed, whether they get access for the Rotary access to the.
Yeah, Lata. The concept here is simple. As a club president or a secretary can give additional access to people who would like to enter the data. Imagine that you are the one who's going to be in the table and entering the data. The club president can immediately give you the access to do that.
So I have to use his password and do it?
No, you don't need to use his password. They can give you the admin rights access in a minute.
All right. Thank you.
We already trained all the presidents on how to do it.
Thank you.
Sir, am I audible?
Yes.
Sir, myself, District Governor nominee Nigam Chaudhary from 3055. My hometown is a very small town, and we have been doing a project, Save Your Kidney, since last 3 years. We have our own medical setup in our club. We have a medical center with qualified doctors. So what we do with the local merchant association, we have collaborated and floated this project Save Your Kidney, where we go to each and every society every week of 12 months to each society. We test them for all these 4 parameters you already mentioned: height, weight, and blood pressure and blood sugar. At the end of the this whole thing, if any patient who has been found with diabetes, I mean, if he's unaware of that particular disease and he's found with diabetes, then we on the site only we have our own doctors, physicians who consult them, who give them advices for further precautions. But last thing I would like to mention that after those people who have been found with this disease, we have formed a diabetes club in our medical center, where we enroll them with just 100 rupee, and for the 12 months of the year, we check them for their creatinine, their blood sugar, urine sugar, everything. So we keep their record for a year, and we check them every month so that we can get the results whether they have been improved or not. So all this project is going on since last 3 years, but in the name of Save Your Kidney, can we club this both the things together with the project help?
So I think Nigam, you already answered yourself that you are checking all the 4 parameters. So this is very much part of a project. Save Your Kidney, you are just narrowing down to only one thing. So are you only going to save the kidney and ignore the heart? No. So you can broaden this. See, you can keep your Save Your Kidney because that is what you are doing for 3 years. But you can, under the umbrella of Project Positive Health, you can continue doing this. See, as Director Anirudh mentioned, our idea is to have a simple outline presented to all clubs. You can scale up whatever you want to scale up. You are free to scale up and do whatever exactly you want to do actually. But minimum these couple of things you need to do. That is what we are saying.
Yes, yes.
And
For
this
that we
definitely
are
forms,
running
now you only,
advertising on.
what is only needed is for you to enter this data on the Rotary India app actually, PPH app actually.
Okay, okay. We shall do that, sir.
Right.
Thank you.
Siddharth.
Hello, everyone. I'm Dr. Siddharth Udeshi from Rotary Club of Addiction Prevention 3141. Narendra ji, my question was, can we have an Excel sheet where the data can be added and then it can be uploaded to the website, which might be a little better when we go for camps?
No, see, of course, you can very well do that. You can write it in a paper, then you do the entry yourself. Is absolutely your choice. There is no problem at all. The only thing is you can't upload an Excel sheet because what we have done in this is imagine that if Siddharth Udeshis come again next time, automatically the system will capture that data when you're entering it itself. And it will tell you that what was your earlier parameter and today what's the new parameter. That will also help you when you're entering it, the changes which has happened to that particular attendee from last time to this time. So we can't have an upload of an Excel sheet, but you can enter the data offline sitting at home. So in case
So if I'm coming for the second time, the attendee will have the old data right away.
Yes. So let's say you are an attendee and you're coming for the second time after 1 month, example, and when I'm typing your mobile number, it will fetch your old data and tell you what was your earlier parameter.
Okay. Thank you.
There is another problem that once you upload in our system, so you can have a view of the total number that you are having, that will automatically add.
Yeah,
But,
you get the entire report for yourself.
Yes,
So
but if you enter it through the
upload it in the
Excel
back
sheet,
end.
that will not match with our online system. So that is another problem.
He was trying to say he wants to have it in our system. What I think is, can he upload it from a backend in Excel sheet? I said that cannot be done. He has to enter it separately.
Bhupesh.
Yeah, Bhupesh, go ahead.
We can't hear you.
Your voice is low.
Can you hear me?
Yes.
Yeah.
After the camp, can we create the WhatsApp group for the to follow up the patients? Broadcasting group to take the follow up with the patient.
You can do that.
You can create the WhatsApp group.
You can do that. You can do that.
Thank you.
Mehul.
Yes, my question to Bharat Bhai and Anirudh ji. See, you have, Bharat Bhai, said that we can launch from 1st October or this 29th Heart Day. That's a nice idea. On 7th and 8th October in Ahmedabad, there is a great national expo on only and only health. They have contacted me and they want Rotary to be involved with them. I have to reply them. Can we launch some big way there so that I can negotiate them? If something is there, you can just guide me so that I can negotiate with them. They are ready to give us free stall also.
So you can, if they are ready to give you a stall, Mehul, you can take that stall and launch this project Positive Health. At one of the conferences, Dr. JP Vyas from your district had this stall, and he knows all about how to manage the stall and how to do that. So I think JP would be of great help. He's also part of this interest actually. No?
Okay, thank you.
You can definitely do that. I mean, that will be great public image for Rotary, plus a great service to the people. 2 days you will be checking people free of cost or whatever here.
Thank you.
So I think there are no more questions, Anirudh. So Anirudh, on your behalf, let me tell everybody that we are relaunching this program in a very simple way. As Anirudh said, we can scale up whatever we want to way. And you know, this is not a program which is going to remain the same 5 years down the line. I am sure things are going to change. More things will be added, some things will be taken away. So as we learn more and more, the program can become better and better. Maybe we can go back. What the clubs can do is that to have a follow-up, clubs can announce, okay, today we are doing this camp in your area. 6 months after this, we are going to come back to your area. So come back after 6 months to get yourself checked again. I mean, this is just some random thought I am giving. So things will change, but let us at least start doing this initiative. So that, and I hope that we can definitely take this forward. From you, last words, Anirudh.
my only request to each one of you who are will be driving this project, or you will be a part of this project, whatever capacity will be a part of this initiative, try to try to scale up, but try to get the involved the other stakeholders also, because today if you really wanted to make it a bigger, and that these are the number games, I'm telling you, because as we mentioned, that we have been mentioning earlier also, that there are two sections of the people in the community. One, the students. So we should go to the schools, and we should also, arrange camps. So we are trying to, capture the both ends. The end, those who are now in a formative stage, another those who are already in a stage where they are prone to this kind of a diseases. So our approach has been both the sides. Only thing is that whatever you do it, try to involve government or the local administration. Then only you will get a lot of opportunities, a lot of insight of this project, and you can get to scale up. You can, you can do the data. You can, add other things also. So it will get a good recognition also. That is what is required. You want to make it a, that civil, that the civil society should be part of this initiative, because after all, this is a matter of health. That today, for any government today, I'm talking about the US government or our government, the maximum allocation of the fund is on healthcare. The huge expenses on the exchequer, but we can prevent our diseases, and our demographic is still, in India is the younger, but this, the population going slowly to that age when this kind of a disease will set in. So now this is the time Rotary can show them the path. Yes, prevention is, as I said, one gentleman was there, it is a part of this, thalassemia. It's totally a preventable disease. We can do this. This is how I said we can do a lot of things with this. It's a unique project, and everybody should be a part of it. Bring your, rotractors, your interactors, and your inner wheel members. Create a mass awareness. That is where success of this program will be. Thank you once again, and we are all by your side to give the total support.
So thank you very much, Dr. Bharat, RID Anirudh, and RID Raju in absentia, and all the participants. Today we are the Rotary India team. We are really elated that the thought that we executed today by having a separate master class on PPH camp proved to be extremely useful and successful. And I'm sure the initiative took by both the directors and the trustee will bear better fruits in the months to come. So on behalf of the Rotary India team, let me thank all of you once again. And with a happy note, we are ending today's session, but with the promise that by today evening, you will get a synopsis of today's program along with the entire video recording and the separate video recording of IFRM District 350. Thank you very much. Do join next week, next Wednesday, 4:30. We'll come up with a separate topic. Thank you very much. Enjoy.
Thank you, everybody. Thank you.
Thank you.